page number 9, next page, and on page number 9, so we have talked about COPD. I want everyone make sure these are all the important information on COPD. So whatever we said, you wrote it down and memorized that, and same thing I talk in the respiratory system. But on page number 9, important word, excavation. What is the meaning, excavation? When they're saying patient is admitted with excavation, means acute, very sick. Excavation word means acute. Now they don't use the word acute, and they're saying patient has excavation, meaning patient rheumatoid arthritis patient. People that disease never goes. And what are two words we use? Excavation and remission. What is remission? When they're feeling better. But they give you a question, patient has excavation of rheumatoid arthritis. Patient has excavation of your patient multiple sclerosis. What does it mean? Their pain is more. Multiple sclerosis means neurological problem, right? And what is the problem with neurological in multiple sclerosis? Their muscles are weak. What is your first answer is going to be? It's acute, very painful, and they get tired, the disease gets worse. They're checking your knowledge by one word and how you pick up your answer. Any question? Diseases which never goes away, they have excavation and they have remission. Remission means they're getting better. Excavation means they're very acute. Patient is admitted with multiple sclerosis and has excavation. They did not give you this word. What would you do for your patient? Number one answer would be here. Rest and activities in between rest. Activities in between rest. The meaning, whatever you are doing for your patient, don't do it one time. Patient must take rest, because if they get tired and the muscle get tired, the patient condition get worse. Patient with rheumatoid arthritis, patient has excavation, meaning patient has a lot of pain. Now here, what do you do for your pain? Are you going to continue range of motion? No. What are you going to give here? Isometric exercise. So your answer would be isometric exercise. Now here, if you will not understand the word and you say continue range of motion, your answer would be wrong. Are we clear? So everyone, please understand the word 27 is excavation. Your patient is very sick. Always your answer is going to be either rest or give your exercise in between rest, or your exercise should be more, is called isometric exercise. Number 28, epinephrine. You use it for anaphylactic reaction. You're using the TB syringe. Number 29, when you are giving prednisone, are your steroids. Where do we get the steroids? Where do we get the steroids? What gland is producing our steroids is adrenal gland. What disease are concerned with adrenal gland are Cushing and Addison. Addison is low steroids, Cushing is too much steroid. Any patient you are giving a steroid or prednisone, ending word is going to be zone and salone. And what do you monitor patient? You are turning them into Cushing. What is another word for your medication is, everyone remember the word glucocorticoid. You must know this word. Glucocorticoid and mineral corticoid. When I'm writing mineral corticoid, this is given for your patient with Addison in treatment because they need a steroid. Now some question they can give you, doctor has ordered prednisone. But a lot of questions, they may say patient is on glucocorticoid, meaning patient is taking a steroid. What do you monitor your patient when you're giving a steroid? You are turning them into Cushing. That's number one answer. And you all know buffalo hump, moon face. But what is high when you give your patient a steroid or Cushing. I will write down here and you remember the word. They have high sodium, high sugar, and their blood pressure goes high. What is low here? Potassium. What is low here? Calcium. Everyone remember is whenever you're giving steroids, number one, and Cushing, what isolation, you will take them, prevent them from infection. Put them in reverse isolation. And number two, you monitor, you are turning your patient into Cushing. Number three, what do you monitor is hyperglycemia. They will need insulin. Patient says, I'm not a diabetic, but doctor started steroid and my sugar is high. What does it mean? Because of steroid, their blood sugar goes very high and they will be on sliding scale, maybe on insulin. If they're diabetic, insulin, they will need more. Number two answer, after that, make sure low calcium. Low calcium is risk for fracture. Everyone should know steroids, sugar is high, hyperglycemia question, and you prevent them from fall. Remember, we are learning to prevent the fractures. And why? Patients who are on steroid, gentle handling, because they're risk for fracture. So number 29 is everyone is steroids word. Remember the word glucocorticoid, mineral corticoid. Number 30, patient has cancer. How do you treat them? By chemo, radiation, surgery, or die them with dignity, let them die. That means hospice care. Write down the word hospice care. What is a hospice care? Comfort care, pain-free. Give the pain medication before even time. As their time comes, every 4 hours. Don't wait it, give every 4 hours. What is the goal here? Is comfort and keep them free of pain. And that's important on dignity. Number 31, no live vaccine, no fresh fruits, no flowers when you have neutropenia. Underline that word, low white blood count. Reverse isolation and no fruits, no vegetable, all that you will know. So neutropenia means white blood count. Number 32, pleural space, underline. Where do you insert the chest tube is in pleural space. Where do you put the needle when you're doing thoracosynthesis? Pleural space. Everyone should know. What is a pleural space? Around the lungs. There is a layer, there is a fluid, and they put the needle, they take out the fluid. And what are we removing when you're putting a chest tube? Either you're draining air or you're draining the fluid. Some question, patient says, I don't see any fluid or blood is coming out. Maybe their draining is what is from there is the air which is compressing the lungs. So chest tubes are put it in to drain, but where do you put the chest tube? In pleural space. Number 33, angina. What is angina? Is low oxygen to the heart, lack of oxygen, no dead heart tissue. That means the tissues are not dead. But MI patient, the heart muscles are dying. And I want you to write down one word here for angina, coronary artery disease, CAD word. What is angina pains are? Coronary artery disease. If they give you a question, you have a patient who is admitted with CAD, coronary artery disease. Where is the blockage in heart is coronary artery. Everyone should know. What muscles are they're affected are called myocardium. Your inner layer is the middle layer of the heart is myocardium. Endocardium, when you have, that is bad heart problem. That means the valve. So remember, for angina, MI, coronary artery is blocked, myocardium is affected. And if they give you, patient is admitted coronary artery disease, what are you monitoring? Chest pain. May not be angina word. How do you relieve, how does angina pain comes? How does angina pain comes? On stress and exertion. If pain comes on rest, that is not angina. Everyone is okay. So how do you treat angina patient are, number one, rest, and number two, by giving nitroglycerin. So everyone, angina questions are, remember, your question can be non-therapeutic. Again, no drug. Non-therapeutic treatment for angina is, your answer would be rest. Stop activity. So don't only pick up nitroglycerin, because angina pain will need a stress and nitroglycerin. What do you monitor before you give nitroglycerin? Is the blood pressure. Side effect of nitroglycerin is headache, and it lowers the blood pressure. So make sure you monitor blood pressure. Any question they give you, blood pressure is dropping, do not give the next dose of medication. What is the medication nitroglycerin is under the tongue? Nitroglycerin comes in the spray, and nitroglycerin you also have the patches. In your patches question, must wear the gloves, non-hairy area. Apply in the morning and remove it and reapply again in the morning. That means evening we should remove those patches in your question. And because it has effect about 12 hours. And so you must remove those patches and reapply it. So everyone should know the nitroglycerin questions are, and as angina question. So angina, number 33. 34 is Mevacor. Mevacor is your cholesterol medication, anti-cholesterol. What is other group of medication of cholesterol are called a statin. Make sure write down the word. All your statin word is your cholesterol medication. Is a statin, S-T-A-T-I-N, Mavostatin, somatostatin. So last word statin, your cholesterol. So remember, if you memorize some last word, that helps you to know some of your drug. Now it says Mevacor is the best time your cholesterol medication when to give. Underline the word. The doctor will order it once a day. But once a day, the best time is in the evening after meal. So underline the word is in the evening, and you're giving once a day. What do you monitor before you give cholesterol medication? I want you to write down, before you give cholesterol medication, what do you monitor? Liver. Liver function test. If liver, they give in your question, patient has liver problem, you cannot start their medication. Why? Because liver is already damaged. And frequently, every 3 months, you must check liver, and you must check also cholesterol level to see if your medication is working. So everyone, before, what time do we give? The best in the evening. What do you check before you give cholesterol medication? Liver function test. Every 3 months we should do it, liver function test. And when you are giving, avoid grapefruit juice. Some of your medication interacts with grapefruit juice. So no grapefruit juice with some of your cholesterol medication are. What is the bad side effect of your cholesterol medications are? What are the side effects are? Number one, very important, is muscle pain. And they may use the word is muscle wasting. Muscle wasting. When you see the word myopathy, that means is for the muscle, myopathy, okay? So patient is complaining, leg cramping. Patient is complaining, I cannot walk. I'm having a lot of muscle pain. What do? Notify your physician immediately, because it's a serious side effect. Another side effect are abdominal discomfort, and number 3, gallstone. It can lead to gallstone. Now those are very important. Everyone should know muscle pain is a severe problem. It's called rhabdomyolysis, and sometimes they use myopathy. And muscle means muscle wasting word, muscle pain, myo word, that all your muscles. So at least the last word of your medication is called statin. That's your cholesterol medication. Now I will move on. 35, nitroglycerin, we already talked about. Give them and check the blood pressure. At the end it says the blood pressure 90/60, you got to stop the medication. Next is number 36. So headache is important, and renew your medication. If you haven't used it, nitroglycerin, and you must change it every 3 to 6 months. If the bottle is open and is sitting there, haven't been used, every 3 months you must renew the medication. They're no longer good. And remember, it must tingle. When you are putting it, you feel sensation. If there's no feeling, that means your nitroglycerins are not good. Next is, you will go on, it says preload. Underline the word amount of blood that goes to the right ventricle after load. Preload drugs, afterload drug is when it leaves to the right ventricle. Afterload means after they leaving to the blood. Number 37, calcium channel blocker are your cardiac medication, blood pressure medication. So write down calcium channel blockers are your blood pressure medication. And they work good after load. And what is side effect of calcium channel blocker is number 1, constipation. They can constipate. And number 2, monitor edema. That means it affects the heart. Any edema is not good, and calcium channel blocker. One of the drug is calcium channel blocker. Very common is Procardia. And Procardia can also be given sublingual for PRN when the blood pressure is very high. And Procardia, remember, some of your blood pressure medication can be used for chest pain. Your beta blockers can be used, your calcium channel blocker. Instead of nitroglycerin, they can use the blood pressure medication. Keep that in mind, because there are some questions. What are the other drugs can you use for chest pain? Your blood pressure medication, and because they are vasodilator. Number 38 is CABG, coronary artery bypass graft. Which area they use to do the graft? Underline the word saphenous vein. That's important. And coronary artery bypass is done when patient has MI and there's a blockage in the blood vessels. Number 39 is unstable angina. There are 2 angina, stable angina, unstable angina. Unstable means pain is not relieved with nitroglycerin. Stable means pain is relieved with nitroglycerin. So when you give nitroglycerin, pain is relieved. There's another one is called vasospastic and premixal angina. So there are few types of angina. Everyone should know stable. That means patient is feeling okay after you give medication. I want you to write down premixal, P-R-I-C-M-E-N-T-A-L. Premixal, and that's another, and it's also called vasospastic angina. It comes on rest. When they're saying, patient is saying, I'm in a bed for last 1 week, I'm getting a chest pain when I'm laying in a bed. It's not it's not a angina pain, but it's called premixal angina vasospastic. That means comes on the rest. Any pain comes on rest is not angina. Immediate attention, we should do it, assess your patient, send it to the hospital, maybe patient has MI. So 39 is some of that wording are there. Number 40, premature ventricular contraction. Underline that. Premature means the heart is beating very fast. They're not giving a good contraction, and it will be untreated and lead to ventricular fibrillation. Highlight the word ventricular fibrillation. What is ventricular fibrillation? Is not good. Tachycardia is not good. Patient is having chest pain, and patient is having a ventricular contraction, PVC. Premature contractions are not good. And if your ventricles are giving premature ventricular contraction, it's going to lead to ventricular fibrillation. What do you do when patient has ventricular fibrillation? You're getting ready to start the CPR, call for help, write down the word defibrillator. You're using defibrillator. What is the 3 energy level we are using? From 200 joules to 360 joules. 360 joules. So when you are applying defibrillator, remember, you're doing defibrillator, you are giving energy. They use the word energy. You start with 200, you can go 300, and maximum they go for 360 energy on your patient. What is the good medication you can give them when patient has at the time the blood pressure is dropping, no vital sign? Epinephrine, lidocaine is good. Lidocaine is good for ventricular fibrillation patients are. And you can give also is the epinephrine for the blood pressure. Epinephrine. Now, everyone should add there ventricular fibrillation. Patient is having ventricular fibrillation is bad. What do? Immediately get help and start defibrillator, start CPR, and the Jolas word. 41 is a lot of your calculation things here. So make sure you guys know your ounces, calculation for INO, they're giving, and 30 ml, a cup, 8 ounces, quart, 2 pints. So go over on that. In the last, pound into ounces, converts Fahrenheit into centigrade and centigrade into Fahrenheit. So please look those, some of your calculation and your conversion. 42 is called angiotensin 2 in the lung, and they are vasodilator. Aldosterone attracts sodium. I want you to write down there, they call angiotensin, are called ACE inhibitor. ACE inhibitor. What is ACE inhibitor? Are your PRIL. P-R-I-L at the end. So ACE inhibitor, and it says here conversion angiotensin. So remember, when you are saying ACE inhibitor, where does ACE inhibitor converting? And that would be, you have angiotensin. So everyone, conversion of angiotensins are by PRIL. And what does it do? Lower the blood pressure. So everyone, PRIL word is important, conversion of angiotensin and the low blood pressure. What is the main side effect of your PRIL are at the end? Cough, hacking cough. Patient is coughing, you must notify. That's number 1 answer. Number 2, there are a lot of side effects, but remember, few side effects, every medication are common. Like I said, in statin, the muscle, very important, you should know. There are more side effects, but that is important, you must not forget. For angiotensin, blood pressure medication, causing constant patient is coughing, dry cough, hacking cough, they cannot continue. They got to take the medication. Fever and sore throat. If patient has fever and sore throat, that means in a lot of medication are not good. Why? Because they are affecting the blood cells and is causing them to have changes in the body and risk for getting infection. So number 42 is angiotensin word, and everyone remember the word is PRIL. And anytime any cardiac medication you're giving, what do you monitor? Whether it's say your arrhythmia medication, whether it's your blood pressure medication, you monitor for low blood pressure and dizziness. What do you teach patient? Get up slowly. What do you cut down in the diet? Salt, because salts are retaining fluid. So remember, on your cardiac patient, 2 things remember, salt, cholesterol, teaching them for safety, get up slowly, and say your call light, ambulate your patient with safety. Next is 43 are adverse effect. What are the adverse effect or medication antidote you're using? Heparin. When you are giving heparin, antidote, protamine, sulfate. Underneath, Coumadin, you are giving vitamin K. How do you give Coumadin? How do you give heparin? How do we give heparin? Sub-Q, and you can give IV. No IM. Sub-Q you are giving. Never massage them. Never draw the needle. Coumadin, you are giving by mouth, PO. And what do you avoid when you are giving Coumadin? Green leafy vegetables. They're very high in the vitamin K. Number 3, ammonia. Which patient has high ammonia level? Liver cirrhosis. Make sure you add there. What do you cut down here? What medication do you give them? Lactulose. What are the other medication? I want you to write down there is, what are the other medication? Antibiotic. You give them Flagyl. You can give them Flagyl also, and lowering. What are you lowering here? Ammonia level. So you can add there. They can also give them Flagyl. And what diet would you go here when ammonia level is high? Liver cirrhosis. What do you cut down? Protein. Very good. So write down the word protein. So patient has liver cirrhosis. They have edema. They have ascites. You can give them diuretics also. And you're going to cut down all other drugs because ammonia level, what does ammonia level does? Is affecting the brain. And what would be it is causing here? Remember the word encephalopathy. So let's just remember lactulose. Lactulose is used. What is the side effect of lactulose? Diarrhea. So write down on the side diarrhea. Acetaminophen is Tylenol. Everyone should know Tylenol toxicity is N-acetylcysteine, and another word is called mucomist. So write down the word mucomist. And when you are giving mucomist, it helps to loosen up the secretion, and also what do? Increase fluid. So iron, when you give too much of blood transfusion, anemic patient, and what happened? Iron overload. And what do? Medication, defroxamine, and also increase fluid. So because that helps them to lower. So iron, antidote, defroxamine. Digoxin antidote is digibine. Alcohol withdrawal patients are Librium. And also write down Ativan, you can give them. And ant abuse, another treatment is ant abuse. But remember, for ant abuse is, what do you remember? Alcohol free for 12 hours before you give them. So highlight that. Methadone is given to detoxify for opiate analgesic. But methadone, we do not give when you're detoxified. But you can give methadone for pain. Underline that. If doctor has ordered methadone for pain, we can administer. But detoxification, it's done in a clinic and with a special supervision. Potassium affect toxicity, digoxin. 44, heparin is prevent for platelet aggregation. PT, I would say not PTT, but write down the word PTINR, is for Coumadin. PTINR. PTINR, for Coumadin we do it. And more than INR, normal INR is 2.0 to 3.0. If you have INR 7 or 10, the risk for bleeding, and you will give them antidote. Cardiac output is decreasing and leading dysarrhythmia. And dysarrhythmia means abnormal heartbeat. Dopamine is given to raise the blood pressure. Which patient do you give dopamine? Write down the word MI. Patient has heart attack, patient is going in shock, their blood pressure is dropping, and you're going to give them dopamine. The first thing is stabilize the blood pressure. Ventricular tachycardia. Tachycardia is not good. Medication for ventricular tachycardia, lidocaine. superior or supraventricular tachycardia. So lidocaine is for tachycardia, dysarrhythmia, and next one, adenosine, adenochord, they are for abnormal heartbeat. No heartbeat, you can also give atropine. So these are some of your drugs. Start memorizing and some of the side effects. Next page, number 10. CHF. When patient has CHF, ACE inhibitor means Pril, you can give them. So Pril are good for CHF. Anaphylactic shock, you will give epinephrine. Number 52, on next page, number 10. Status epilepticus. What is status epilepticus is? A long seizure. Write down the word long seizure. Which patient do you monitor a status epilepticus? Patient who are non-compliant, head injury, alcohol withdrawal patient are, they're going to go into status epilepticus. What is your priority for your patient who's having a long seizure? What is your priority? Airway. And what do you give the medication? What medication you will give to relax them? Valium. So write down there Valium and Ativan, you can give them. Ativan and Valium is anxiety medication. Now, since we are on seizure, and Valium and Ativan you can give them, and what do you monitor when your patient is having seizure? Number one, safety, protect the head injury. Safety is number one, because they can get a lot of injury, and airway. And what position can you put them? You can only turn them on the side, prevent aspiration. What do you monitor your patient when they are having seizure? Is we all know the time and duration, very important, and activity. What kind of muscles are moving? Activity means how is their body was reacting when patient is having seizure. So everyone write down the wording is on seizure. What is post-ictal word? What is post-ictal word? Post-ictal seizure. What is post-ictal seizure? After seizure. Post means after. Ictal phase is after seizure. What do you monitor after patient is seizuring? Is what are they doing here? They are sleeping. And after post-ictal, sleeping answer or confusion. After the seizure, patient having confusion. So few things is important to know about seizure, status epilepticus. Number 53, bipolar patient are taking what drug? Lithium. And what is the level for lithium? What is the level for lithium? What is the normal level for lithium? Lithium is 0.5 to 1.5. So write down there, everyone should know. Lithium is important drug, 0.5 to 1.5. If they give you more than 1.5, patient is in toxicity. What are the sign and symptom of toxicity is vomiting, they're having diarrhea, weakness, ataxia. What do you give them? What do you give when they have side effect? You got to give fluids. And what fluids? You give them normal saline. What do you teach patient who is taking lithium? Not to cut down their salt, they need to continue regular salt and increase fluid. Are we clear? Salt and fluid in your teaching question. So please write down. You must know the level. Write down at the side. And you must know the side effect. A patient has vomiting, diarrhea, and weakness, ataxia, that means that is a problem. It's a bipolar medication. This is one of the drugs we're using for bipolar. 54 is amiodarone, is for ventricular and atrial complication. Amiodarone is for dysarrhythmia, abnormal heartbeat. What do you monitor? Blood pressure. S3 sound is normal in CHF, not normal in MI. You remember heart sounds are? Which are the heart sounds are normal? S1, S2 are normal. Make sure you know S1, S2 are normal. S3 you will see for CHF patient. S4 you will see maybe in MI patient. What is S1? It's a lub-dub sound. What is S1 is? Closing of atrial and ventricular valve. So remember the word AV valve. What are your AV valves are? Tricuspid and bicuspid or mitral valve. So tricuspid valve and bicuspid valve, when they are closing, you are hearing the sound which is normal. And what is S2 is? Semilunar valves. Where are your semilunar valves are? In pulmonary artery and aorta. And that is normal. They're closing. So what is S1, S2 sounds are? Normal heartbeat, and you hear lub-dub sound. But when you don't hear complete sound, that is very weak, and you hear only dub-dub sound, not like a full sound. That is S3, which is common in CHF and S4. So these are the heart sound. S1, S2 is normal. S3 is not normal. You will hear in CHF. Carafate, number 56, for your GI medication for ulcers. And what does it do? Coat the stomach. Number 57, Proteinax is also for ulcer. So recognizing medication is important. Carafate, Proteinax. Then after endoscopy, what is endoscopy? Where do we use endoscopy? Is number one for your GI patient. When patient has problem, and remember, I want you to write down 2 words. Every system, if you understand, patient is going endoscopy. It's invasive procedure. They're putting a scope through the mouth. And what are the 2 words called here is EGD. And second word is called ERCP. This is esophagus. G means gastric, D means duodenum. And they're looking through for your patient. ERCP is a long word. It's called endoscopic retrograde cholangiopancreatography. When they give you a question, patient has pancreatic cancer, a patient has pancreatitis, what test do? You will pick up this answer. And what is the word is called? Endoscopy. They're putting the scope. They're looking all GI system. ERCP, they're looking for biliary. Biliary means liver, gallbladder, and pancreas. Hepatobiliary area. This is the stomach area and the duodenum. Same answer for 3 of them. Number 1, it's invasive procedure. Number 2, you need a consent. And number 3, before test, NPO, to prevent aspiration. All of them NPO, your first answer. And second, after the patient come back, all of them, you're monitoring, you guys have in your notes, gag reflex. I want you to add there the word perforation, meaning patient is bleeding. So what is patient is, have you monitor? Bleeding, and do not give them fluid until patient returns gag reflex. So endoscopic, number 58, you guys have gag reflex, add their perforation, add their word EGD, ERCP, same answer. Pancreas question, patient has pancreatitis, patient has pancreatic cancer. What test you will schedule patient is ERCP. So that's your test for looking through. Now I will move on, number 59. On 59, you have TPN. How do we give TPN? Subclavian vein. And what else can you give through the subclavian vein? You can give drugs, you can give medication, fluid, and TPN. Total parental nutrition. Where do you keep total parental nutrition? Where do you keep it? In the fridge. And who prepares TPN? The pharmacist. And what lab you need to do it? You got to do electrolytes, sodium, potassium, and you are monitoring their all electrolytes. So blood test is important as doctor order every 2 days and 3 days, and you fax the lab result to the pharmacy because they are looking into what is your normal levels of your patient are. So it's a food. Now tell me which patient are you going to give TPN? So we are feeding patient. It's a food. That means patient is not able to take the food. But which patient are you going to give your food when they have only intestinal problem, not swallowing? If they give you a question, patient had a stroke, what do you feed your patient? You have IV, you have NG tube, you have GQ, and you have TPN. These are all ways you can feed. Patient had a stroke. Patient is not able to swallow. How would you, which one do you pick up your answer? IV, never pick up because it's only fluid. You can only give 1 and 2 days, but if you're giving food, that's not a good method. 1 to 2 days, patient is not getting food. And G-tube is a surgery. You don't want to go right away. This is more invasive procedure. So your best answer for swallowing, you try with NG tube. Patient keeps pulling out the NG tube, then you will go. Patient would not swallow maybe for 2 years and 3 years, but patient is very uncomfortable, and for last 3 months you have been feeding and patient pulling out tube every week. Maybe now we can, so never pick up your first answer G-tube because it's a surgery. Always try with NG-tube, then you move on G-tube, and TPN is only given not for swallowing, but absorption problem. Are we clear? Why? Because a stomach, you have maybe a cancer. Maybe they have removed the part of the intestine and patient cannot absorb. Maybe patient has colitis. Maybe patient has severe abdominal bad infection for longer time. And so you're not going to do the G-tube because why? The food will go straight in the stomach. When you're giving TPN, the food is going where? In the blood. And your patient is getting the nutrients. Now, next question. So everyone remember, never pick up your answer TPN for swallowing problem. You look for any absorption, your GI, because there is system is a problem. Next thing is, what do you add in NG tube bag? And they give you a question. You receive a bag of TPN from pharmacy. And you notice the pharmacy has added in there is NPH insulin. What would you do? They're looking, if you know how do you give NPH insulin. NPH insulin you only give sub-Q. You cannot give because this is going where? In the blood. So what do? Don't take that maybe answer, put it in the fridge. When you take it, put in the fridge, you're going to use it. Return the bag to the pharmacy. Don't take it. You cannot give. Can you add regular insulin? Yes, because you can give IV. Can you add vitamins? Yes, because that can be given IV. So any vitamins they can add there in the food and they can give them insulin. And what do you monitor? So remember your answers are here. These are the way they're going to look, whether you know what is TPN. There's no longer one answer. What do you monitor? Hyperglycemia. No. What do you monitor for a patient with TPNR? Number one is you are monitoring hyperglycemia, number one. And you have to check their blood sugar. Doctor would already order to check blood sugar and sliding scale. You're giving insulin. So what are you monitoring here in your question? Is hyperglycemia. What are you monitoring here? It's a food. Number two, patient's weight. And how do you know your TPN is effective? How do we know our TPN is effective? Patient is gaining weight. If it is not effective, patient is losing weight. You got to notify and they got to do something. You don't want your patient is losing weight. But what would you report it to the doctor? The weight problem patient has. And number 3, which is important, infection. They give you patient is running fever. A patient white blood count is high and patient sugar is high. Which one do you pick up? White blood count. Patient would die with infection and sugar. Doctor has already ordered to give insulin in your order. And they're just checking your knowledge. So everyone, TPN patient, avoid them, do not give them shower. More is sponge bath, cleaning is good because risk of water getting inside can cause infection and contamination. So these are, can LVN change the dressing? Yes, because you are only cleaning and you're putting a transparent dressing. So yes, LVN can change the dressing. Pump is beeping with TPN and IV. Do not turn off as a LVN. What do? Check position, fix the position, but do not turn it off. Your RN should turn it off and check for TPN and IV. Same thing, CNA. CNA is in the room. Your feeding pump is beeping. Does CNA should turn off the pump? No. They should call you and check your feeding, and then you check what do you have to do. But remember, it's out of scope of practice for us to turn it off. You let the RN come and assess. So that covers your TPN question. Number 60 is low residual diet, means low fiber. When patients are having diarrhea and a stomach problem, and I will be talking some of the disease, mostly we cut down the fiber. Are we clear? And what is fiber you give to prevent constipation? If they're having diarrhea, in your diet, cut down the fiber because it causes more pain. Number 61, so make sure fiber works. And diverticulitis. I want to go over on diverticulitis. What is a diverticulitis? Comes from diverticula. Remember the word diverticula. So they're not going to give you diverticulosis. Patient comes in and patient has diverticulitis. What is the meaning is here, patient is already has small pouch in the intestine, and that is called diverticulosis. So remember, what is diverticulosis? Patient has small different pouches in the intestine. What happened in the pouch? Those are like little pouch. The food and the BM can stuck there. And what does it cause now? Infection. So the problem is because they have pouch and they got infection, patient is coming to the hospital. And patient has diverticulitis. So everyone remember in your back, your questions are, there is a pouch. Are we clear? And if the food gets stuck. And what does it cause here? All your itis word are infection. Appendicitis, diverticulitis, anything, colitis, that's infection. So patient is admitted with infection. So what is your, if they ask you, patient is admitted with diverticulitis, what is your priority for your patient to treat the fever, treat the infection? Then you're going to answer your fiber question. So number 1, I want you guys, everyone, add the word diverticuli at the side, pouch word, and pain. Where is the pain is very important. Left lower quadrant. So where is the patient has pain? Left lower quadrant. Patient is having diarrhea. And what would you do? Patient comes in. So patient has severe diarrhea, but main thing, patient has infection, abdominal distension maybe they have, and they are having vomiting and maybe severe diarrhea. Okay. Now what do you do when patient comes acute diverticulitis? Number 1, treat for infection. Number 2 is NPO. Remember, anything in GI, NPO is number 1. Keep the patient NPO. Let the stomach rest. Number 3 is increase fluids. And what do you do in fluids? Maybe IV, they're saying, or PO. Patient can drink by mouth, that's fine. But what do you increase here? Fluids. Now when they're saying, not acute, but patient has diverticulitis, and what diet are you going to give? This is the one, because they have a lot of diarrhea, only this one, you are increasing fiber. When they stabilize, increase fiber, increase bulk forming laxative. Bulk forming laxative. What is bulk forming laxative? Everyone should know your Metamucil. Metamucil, they will give you. And what is Metamucil? Is in the powder. You've got to mix it in a glass of water. And what do you tell the patient? To follow another glass of water. So diverticulitis, I will completely here. That pain, left lower quadrant, what do you treat? First answer priority, fever, give fluids. Once patient stabilize, this is the only disease where you are increasing fiber. All other diseases, you will cut down the fiber. And what do you increase here? Fluids, and you will give them Metamucil, and patient would be, and increased fluid would be very good answer to complete on that. And what do you teach your patient? No food with seeds. Any kinds of seed they cannot eat. Why? Even a cucumber, inside that seed can block that area and cause infection. We'll take a break now. And so we finished diverticulitis.